confusion, mood and behavior changes, difficulty remembering new information. These are the warning signs of Alzheimer's, a progressive neurodegenerative disease. This disease has an average post-diagnosis life expectancy of about 4 to 8 years. There may be no cure, but there are treatment options. Noticing symptoms early in the disease progression is important so that treatment can begin. This is where language plays an important role. In a 1993 study by Price and other researchers, patients often had language deficits upon initial examination. The connection between language and Alzheimer's can be traced back to the brain. In Alzheimer's, neurodegeneration begins in the hippocampus, a memory center. Even in the early stages, semantic memory can be impaired. Semantic memory is related to language because it is required for long-term knowledge of word meaning. Therefore, as Alzheimer's progresses, language impairments may also become more pronounced. In order to test this, one study compared language use in books written by 3 authors, 1 without Alzheimer's and 2 with or suspected to have Alzheimer's. The findings of the study showed that vocabulary richness decreased as the disease progressed. In this study, it was found that limited word variety may be an early indicator of Alzheimer's.
This is not to say, though, that language has 100% predictive power in Alzheimer's. The Nun study, conducted in 1997 by Snowden, took the autobiographies of 93 nuns from when they first entered the convent at age 18 to 32 and compared them to the autobiographies he had them write at the time of the study, when they were 75 to 87 years of age. Snowden assessed linguistic abilities between the 2 autobiographies. He found that although some of the nuns with Alzheimer's had diminished language abilities, not all of the nuns with Alzheimer's were found to have language deficits. Due to the inconsistencies, language cannot be used to diagnose Alzheimer's, but this does not diminish the importance of language as a predictive tool in Alzheimer's. The 2 studies show us that every case is individual and symptoms are not universal. The important takeaway is that if an individual shows signs of language deficits, it could be an indicator of Alzheimer's. The earlier this disease is diagnosed, the earlier treatment can be administered, thereby slowing its progression.